everyone, my name is Sabrina Tseu. The topic that I'll be discussing regarding my SSM is a part of woman's reproductive organ, that is the breast. These are the topic outlines that I'll be covering. Firstly is the introduction, second is the anatomy of the breast, thirdly is the mechanism of breast milk, fourth is related disease may occur, and fifth is the treatments available in order to cure the disease, and lastly is world/Malaysian known specialists. Starting off with the introduction, the breasts are located the furthest compared to other reproductive organs, such the uterus, the ovary, and so on. However, they are still considered as part of it. It plays an important role into producing milk for infants. For the anatomy of the breast, it is a pair of organs that are located at the anterior side of the thoracic region. It lies at the superficial to the pectoral fascia, covering the pectoralis major muscle. The breast consists of deep networks of mammary glands surrounded by adipose tissue and suspensory retinacular tissue, which it can also be called as interlobular stroma. The interlobular stroma is a network of connective tissue to support and prevent ptosis by anchoring the breast to the chest wall. The adipose tissue makes up most of the content, hence support the mammalian glands. It is circular in nature, with a central nipple surrounded by areola. The areola contains sebaceous glands secrete lipoid fluid to prevent cracking of nipple, hence act as a target for baby to aim for breastfeeding. As for the mechanism of milk production, the production of milk is responsible by the mammalian glands. This process is called lactation. The mammalian glands is formed by multiple lobes that secrete milk into the lactiferous duct. The milk is then stored in the lactiferous sinuses before it is ejected through the nipple during breastfeeding. Before puberty, the breast tissue contains a few lobes, while during the beginning of puberty, before menstruation starts, there is an increase of number of lobules and volume of interlobular stroma. Hence, during pregnancy, the breast increases in both sides and number of lobules, hence decreasing in volume of stroma, due to preparation of the breast for lactation. This is called secretory changes. After the period of breastfeeding, atrophy of lobules occur, reducing both sides and number of lobules, hence reducing the number of milk production. As for the related disease that may occur on the breast is breast cancer. There is still yet a proper reason into the cause of breast cancer, but one of the major factor is due to genetic mutation. There are two genes that are involved in this gene mutation. Firstly is BRCA1 and BRCA2. These two genes are important in order to fight cancer. These are tumor suppressor genes, so when work normally, they help to keep the breast, ovarian, and other types of cells from growing and dividing too rapidly or in an uncontrollable way. So, when mutation occurs in the BRCA genes, this prevents them from working normally, so the person is at risk for breast cancer. Actually, everyone has two copies of BRCA1 and BRCA2 gene. One is inherited from their mother and another one is inherited from the father. Even if a person inherits a BRCA1 or BRCA2 mutation from one parent, they can still have the normal copy of the BRCA1 or 2 genes from the other parents. However, cancer occurs when a second mutation happens that affects the normal copy of the genes. so the person no longer has a BRCA1 and BRCA2 genes that works properly. Unlike the inherited BRCA1 or 2 mutation, the second mutation will not be present throughout the person's body but would only be present in the cancer tissue. Breast and ovarian cancers can also be inherited mutation in genes other than BRCA1 and BRCA2. So in some families with a history of breast cancer and ovarian cancer, family members will not have mutation in BRCA1 or BRCA2, but may have mutation in one of these other genes. There are various types of advanced treatment provided given into treating breast cancer. As shown here, there are 5 treatments. Firstly is surgery, second is chemotherapy, third is hormonal therapy, fourth is radiotherapy, and lastly is targeted therapy. And I'll be briefly describing these provided treatments. Okay, starting off with surgery. This procedure will usually involve the surgeon will remove the tumor and small amount of surrounding tissues. Secondly would be chemotherapy. Chemotherapy is where they will use drugs to target and destroy the cancerous cells in the form of intravenous or IV. Thirdly is radiotherapy, where it uses high energy X-rays, protons or other particles to kill cancerous cells. And the picture below shows a demonstration of the procedure. The fourth treatment provided would be hormonal therapy. This usually slows or stops the growth of hormone-sensitive tumor by blocking the body's ability to produce hormones or by interfering with effects of hormones on the cancer cells. Hence, lastly would be targeted therapy. This uses medicines that are directed at target proteins on the cancer cells that help them grow, spread, and live longer. Usually, targeted drugs works to destroy cancerous cells or slow down their growth. Thus, they have a different side effect compared to chemotherapy. A few known specialists for this field are firstly from Malaysia, Professor Emeritus Dato Ip Cheng Har. She did her MBBS in University Malaya and she was the first surgeon to train under UMMC. A sabbatical in breast surgery in the UK opened her eyes to the potential of the field as a subspecialty with huge scope for research. She has over 225 publications in peer-reviewed journals mainly on breast cancer. She was awarded for her work in breast cancer and is currently working as a consultant breast surgeon in Ramsay Sin Darby Healthcare in Malaysia. Another well-known specialist is Miss Gail McLean. She did her MBBS from King's College and is a member of a fellow of the Royal College of Surgeons of Edinburgh. With over 8 years of consult surgeon experience, Miss McLean specializes in mastectomy, reconstruction of breast cancer, and etc. Miss McLean has also lectured on surgical training internationally. And I think that is all for my SSM presentation. Thank you for listening. Bye.